What is the IL36RN gene link to severe pustular psoriasis? Imagine your skin suddenly developing widespread, painful pustules that can make you feel sick and uncomfortable. That's what happens in severe pustular psoriasis, especially a type called generalized pustular psoriasis. Now, scientists have uncovered a genetic piece of this puzzle, involving a gene called IL36RN. This gene is responsible for making a protein known as interleukin-36 receptor antagonist, or IL36RA. Think of IL36RA as a brake that keeps inflammation in check in your skin. It works by blocking certain signals called interleukin-36 cytokines, which promote inflammation. When the IL36RN gene has mutations or changes, this brake doesn't work properly. As a result, the inflammatory signals run wild, leading to excessive inflammation in the skin. This unchecked inflammation causes the formation of sterile pustules, which are small, pus-filled bumps that appear on the skin's surface. In people with mutations in the IL36RN gene, the defective IL36RA can't effectively inhibit the cytokines. This causes the immune system to overreact, producing more inflammatory molecules like IL-8 and other cytokines. These molecules attract immune cells called neutrophils to the skin, which then gather and form pustules. This process is part of what's called autocrine signaling, where the skin cells and immune cells keep stimulating each other, fueling the inflammation further. The condition caused by IL36RN mutations is often called deficiency of interleukin-36 receptor antagonist, or DITRA. Patients with DITRA usually experience severe symptoms during flare-ups, including high fever, fatigue, and widespread pustular skin eruptions. Research shows that about 1/3 of generalized pustular psoriasis cases are linked to mutations in the IL36RN gene. These mutations are more common in children than adults, suggesting a strong genetic influence on early and severe disease. There are over 20 different mutations identified in this gene, many of which impair the stability of the IL36RA protein or its ability to bind to the receptor. Most of these mutations follow an autosomal recessive inheritance pattern, meaning a person typically needs two copies of the mutated gene to develop the disease. Understanding this genetic link has opened doors for targeted treatments. One such therapy is spesolimab, a monoclonal antibody that blocks the IL36 receptor, helping to reduce inflammation and control pustular flares. This highlights how targeting the IL36 pathway can be effective in managing severe pustular psoriasis. In summary, mutations in the IL36RN gene lead to a loss of function of the IL36RA protein, which normally keeps inflammation in check. Without this regulation, IL36 cytokines cause excessive inflammation, attracting neutrophils and creating the pustules characteristic of severe pustular psoriasis. Recognizing this genetic connection has improved our understanding of the disease and helped develop new, more precise treatments. If you or someone you know is dealing with pustular psoriasis, it's always best to consult a healthcare professional to explore personalized treatment options based on individual needs.